Welcome to Pop Health, TCC's Health and Wellness podcast. I'm Brandon. I am a professor here at Tacoma Community College. I teach both community health and respiratory therapy. And today, our special guest is Brinda.
Hi, this is Brinda. I'm a professor also with the Community Health Program at TCC. And today I might be wearing my hat as a yoga and meditation teacher as well for this conversation that we'll have this morning on aging.
All right, well...
So how are you today, Brandon?
I'm well. I'm kind of over the cold. I'm ready for some sunshine, some warmth. How about yourself?
Beautiful, foggy day. Looking forward to that. Seeing Mount Rainier over the clouds.
Yeah, that's definitely a great view, and you can never get enough of that here in the Northwest. All right, well, our topic today I thought would be something of interest would be aging. It's something that we're all experiencing. Of course, it starts when we are born, but aging in our bodies, of course, does not really start until we're well into our 20s. Despite some of those changes, though, our body does a really phenomenal job doing what it needs to do to compensate, to ensure that we are not declining too fast, too quick, and our functionality. That being said, have you heard of the silver tsunami, Brenda?
Silver tsunami, oh my gosh, what's that?
Silver tsunami. So this is this worldwide event that's occurring with our population. Essentially, it's the individuals who are 60 years old and older. That population is supposed to double by the year 2050. And what's even crazier is that population is going to triple by the year 2100.
You're right. That's the baby boomers, isn't it?
That's right. You got it. I mean, there's so many things and so many implications that come along with our aging population. I think it's really an important goal that we need to work towards in population health at large. So I thought that this would be a great topic to introduce to TCC's community here about healthy aging.
Yeah, I've definitely heard in my different research and studies that this is not only a problem here or an issue that we need to tackle in community health and population health. I've heard that in Japan, Europe, and other parts of the world, our aging population is growing more than our young population. And I think some of the implications that you just mentioned might be needing more care, needing more live-in services for people, more assistance in all kinds of manners, more preventive care, maybe at the secondary and tertiary prevention level. And that's a lot of infrastructure and human resources and things we need to work on. I think you're right. Like, this is definitely a big thing for us in community health.
Oh, for sure. I'm just not sure that we're fully equipped right now to really take on this big silver tsunami, this wave of events and these waves of people. At this point in time, I don't know that we're really ready. What do you think these individuals are doing that are making them live longer?
Well, I think it's been just amazing, like how our access to food and medicines has skyrocketed, and it's been really amazing in this country with Medicare and covering individuals who are, older than 60 with healthcare, and that's been a huge step. But I think there's still many gaps to fill. It reminds me of my own aunt. Right now, she has congestive heart failure, and if you're unfamiliar with that, maybe Brandon can explain.
Yeah, absolutely.
A little bit about that.
Yeah, for sure. So congestive heart failure is just that your heart is not pumping enough to really get a lot of the fluid away from the heart itself. So some of that fluid remains and retains into the body. So then that has a lot of other complications, so like difficulty breathing. You're going to have some swelling in your legs and all sorts of other issues that come along with that.
So imagine this. She had a diagnosis in 2009 of Stevens-Johnson syndrome, which is very debilitating. It sort of feels like a rash outside on your skin and also inside our orifices, inside our nose, eyes, mouth, in that tissue. It was just a nightmare. It felt like she was burned from a fire.
It looks like blisters, right?
Yeah, and her skin was peeling off. So she had this. So there's not many treatments for it. It's a rare disease. So she started taking steroids. The steroids gave her a complication of diabetes. Yeah. She started taking insulin. She's also got this congestive heart failure that's come up after that. And she's been having excess protein, which resulted in gout in her body.
Oh my.
So she's on a number of medications, a few of which are steroids, insulin, and diuretics.
So we're battling one to just treat another?
Yes, and each one has just a horrible sort of effect on the other one, because often steroids and diuretics and these things have opposite effects. So her blood sugar will spike, then she has to take her insulin, and then, she also has to take her diuretics, so all these medicines that she takes have side effects and consequences. And so my question for all of you is, and maybe for Brandon, is how do we stop our elders from getting to this point? What are the lifestyle choices that we can make that prevent sort of hard, difficult, and painful conditions and comorbidities in our old age?
I think that's a great question. I don't think there's a really easy, well-defined path for that either. But what I can speak from, just from my experience, is I think that we need to focus more on living and allowing these individuals to really focus on what's important to them. So setting up some directives and some goals. So what do they want to accomplish? Is it that they want to be able to see their great-grandchildren go to college? Do they want to climb Mount Everest? I don't know. Whatever's important to them, I think that's where it starts. It's really identifying what's important to them and how can we accomplish together as a community to help them reach their goals. Outside of that, though, just providing better access to care, providing better access to good quality care. And when I say care, that is inclusive of not just medicine and therapy, but let's talk about like social connectedness. How important is that? Is for you and I to be able to connect like we are today. I'm grateful for that. But how important is that for that individual who's at home eating by themselves? And that's what they do every day. And they do that every day since their loved one had passed away. So what can we do to engage them and get them back out in the community? And again, meeting their goals and achieving those goals.
I think that's a great question. There's that body-mind complex that we wrestle with in treating in our allopathic healthcare system, which it's somewhat disconnected there, but I think you're right, Brandon. We have so many advanced treatments for the body, but what we haven't, I feel, mastered in Western medical science is prevention and this element of mind, body, and even spirit.
Absolutely.
That taking care of our stress and our social connectedness and our, making sure that elders have a community that they can talk to, be around, call for help, and also give, because I think giving help and being there for people is a huge source of energy and creates a sense of purpose in life. I think what's happening with elders these days is once they're gone and they're living in maybe an assisted living and separated from their family, what is the impact of isolation and just not feeling connected at all, as you rightly said?
No, I think that's a great point. And I think it's just trying to bridge those gaps. Whether it's through more community events. I don't know if that's necessarily the right route. I don't really know what the right route is, but I think that as a community, we can put our heads together, spearhead this, and hopefully, again, bridge those gaps, meet those needs of those individuals, whether it's, a group of 5 or even it's on a one-on-one basis. I think that, just truly identifying how we can really integrate their mind, body, and their spirit. Because like you said, it's really important. Without one of those components, or if one of those components are missing, then we definitely don't have a complete picture.
You know what? I think you're right. And in addition to that, I'm sure you've seen our former President Obama, pictures before and after the presidency, and how even in that 8 years, how much he aged.
Oh, for sure.
And even stress, like us as professionals, as middle of life kind of aged people, that's such a huge component of our physical and mental health. And even techniques on how to stay relaxed and not allow stress to depress our immune system and keep us vulnerable mentally for difficult events in life, which are part of all of our lives. So that's maybe something we can end with today, is some centering techniques that Brandon and I will share. Maybe you want to share yours first, and
Sure.
I can close out with mine.
Yes, for sure. So I think I'm trying to just bring in like probably the most important one in my head would be the power of the breath. I think that taking a minute, whether it's 3 minutes a day in the morning or 3 minutes in the middle of your day, or you know what, why not make it at the end of your day as well, and just focusing on your breathing, allowing you to really hone in on that moment. So being mindful of that very, very minute, just focusing on really deep breaths, every time you inhale, and take that breath in and allow that to fully enrich all your tissues and just feel it all the way down to your toes. And then exhale. And then as you're exhaling any of that stale, stagnant air out of your body. Outside of that, I think, it's outside of just being, mindful and focusing on breath. I think, it's important that we do focus, though, on our physical and our mental activity, staying healthy. And, some of those, if you will, golden rules. So just reminding that our food that we are eating is really the energy, and good nutrition starts there. So eating whole is really important. Another thing that you mentioned earlier was preventative practices. So engaging in vaccinations, engaging in preventative and screening tools, just so that we can prevent things long before they actually occur. What are some things that you'd like to share that you think that would help us declutter and de-stress?
Well, first, before I get into that, I just want to say that I love what you shared, Brandon, and that a lot of what we do in community health is thinking outside the box. So maybe your future projects or initiatives that you start as community health professionals are things as simple as teaching, like going to senior centers and teaching de-stressing techniques, or practicing them in your own life so that you're a better professional in the clinic, in the hospital, wherever you work, and being that beam of calmness and light in your workplace can change a lot of, can have that ripple effect. So I think what he said is really important. And I wanted to share an example of a friend of mine who's in India, who wanted to address this problem of elders' isolation and sort of mental health by starting a tutoring program where she engaged elders in tutoring very low-income children who don't have an opportunity to, maybe their parents work 2-3 jobs and their parents can't help them with homework or teach them how to read and things like that and reinforce their schoolwork. So she started to link up elders and provided a space, and that was her community health initiative that she started. And she's actually an educator, and she's a scholar of English literature and things like that. So she's not even a health professional, but thinking outside the box is such a huge part of changing our trajectory towards an unhealthy aging population to a wonderful life from birth to, our last breath. And something I'd like to share is something, whenever I can remember, something that really helps me out is gratitude. So having that in the morning when I wake up and before I sleep at night is just remembering the blessings I have in my life and the wonderful, my job, my family, my whatever it is that I'm grateful for. And that actually, you will be surprised how calming that is and how centering that is, and puts it in perspective that yes, we all have problems and health problems and family problems and the whole gamut, but at the end of the day, every moment that we live, mostly those moments are beautiful moments, and including spending this time today with you at this podcast. So thanks a lot for having us and listening in.
All right. Well, thank you, Brenda, for coming on. I know I'm certainly very, very grateful to have you here and have you as a peer, a colleague, and a friend. So thank you, and we look forward to hearing from you guys.